Hello viewers, welcome to the channel of Public Safety and Vigilance. In this video, we'll discuss about a recent drug safety update released from UK Health Authority. So this information is relevant to Scopoderm Transdermal Patches. So before going into this further, I would like to highlight this information is very important for people who are easily prone to travel sickness or motion sickness, or the patients who are suffering from medical conditions like hypersecretion or who are under ventilation, patients suffering from drug-induced hypersalivation. There are some drugs which causes hypersalivation as a side effect. So these are the patients, and especially this is useful for people who are expecting a motion sickness or travel sickness who generally use this medication during the travel. So let's have a brief information on the product. So the product name is Scopoderm. It is available in the form of transdermal patches. So this product contains hyoscine hydrobromide as a main active ingredient. This molecule is useful for prevention and treatment of motion sickness or travel sickness. So the main symptoms of this condition includes nausea, vomiting, and vertigo. So this medicine helps us in preventing these kind of symptoms like nausea, vomiting, and vertigo during our travel situations. So these patches are indicated for uses in the adult group population and also in the children. However, children of less than 10 years are not supposed to use this medication. So this is approved only in the children who are having the age of more than 10 years. So guys, if you are aware that children is less than 10 years and they are about to use the transdermal patches, I suggest you to refrain in using this product in those patients or in those children who are having this less than 10 years age to prevent side effects. So we will go through the next slides for more information. So what exactly the MHRA is discussing about? So the UK Health Authority has released this safety update to bring more awareness to the general public on important side effects of this molecule, of this medicine. So these include hypothermia, urinary retention, delirium, hallucinations, seizures, coma, and respiratory paralysis. So these are the situations in the last which usually occurs in higher doses and also during the long-term exposures of this medicine. But don't scare. These kind of side effects are not expected in all the people, or not expected in every situations, and we'll see what are the reasons for these side effects and what are the best ways in mitigating these side effects when they occur. So we'll see. So these are the common reasons or situations where there is more possibility of occurrence of side effects, which we have just seen in our earlier slide. So in the situation, the first scenario, the application of more than one patch. So usually the product is intended to apply is one transdermal patch. If people are utilizing more than one patch, it has potential to cause overdose of the medication. And the second one, the long-term uses or continuous use without a break. So this is intended to use only for a certain period of time, only during the travel time, and this is not intended for long-term use than the recommended. And the third situation, as we have already discussed, the product is not intended to use in children who are having less than 10 years of age. And the last but not least, these side effects we usually see, I mean, the most probable of occurrence of these side effects happens in these two population groups. One is children group and the elder group. So both children and elders are more prone to and having these serious side effects. So guys, if any elder one or any children who are using this transdermal patches, please be cautious of signs and symptoms of these side effects. And let's see if any of your loved ones who have faced these side effects, then how we can manage these side effects and how we can mitigate and how we can increase the benefit of using this medicine, we'll see in this slide. So please be aware of these signs and symptoms of the side effects, like high temperature. Suddenly, if you feel like there is a high temperature in your body, or if you feel like there is inability to urinate, like you are not able to urinate like a usual or normal situation, or you find a confusion or disorientation of yourself, or seeing or hearing things that are not there, this is a kind of hallucinatory symptom. Or you have observed fits or convulsion kind of symptoms, and you have felt that there is a reduced consciousness, and you have observed a difficulty in your breathing rhythm. So if you identify any of these signs and symptoms in you or in your beloved people, like who are traveling, co-traveling, so in those situations, please follow these steps which are listed below. Immediately remove the patch. Whatever the transdermal patch applied to that particular affected individual, remove that immediately, and give certain measures which can reduce the body heat. And immediately seek medical help and contact the nearest physician or any other healthcare professional for health measures. So this kind of measures helps you or your beloved one to prevent the further progression of these side effects to the significant serious effects. And in this way, I mean, by doing these kind of recommendations, by awareness, and by implementing these kind of measures, you can enhance the benefit. I mean, you can increase the maximum efficacy of using these transdermal patches, and you can reduce the potential for causing side effects. So let's increase the benefit and reduce the potential risk, so that you'll be having a more favorable outcomes in utilizing these products. Okay, that's all guys. So I hope this information might be useful for you whenever you are using Scopoderm Transdermal Patches. You can utilize this information for our benefit. If you like this video, you can post a comment if you want.